Good morning, and thank you very much for joining us. I am Yori Polare, and indeed, the lockdown that the president ordered has commenced yesterday, today being Tuesday, yesterday, 11 o'clock. The president had ordered specifically it was going to be Abuja, the federal capital, Ogun State, and Lagos. But Ogun State will join the lockdown fully on Friday, even as it has observed aspects of it. For instance, this whole matter of vehicular movement, I understand. We'll be talking about that. And again, yesterday, the big news, first of all, I should say, my colleague, Cyril Abaku, he's of our research bureau. Good morning, Cyril.
Pleasure being here.
Indeed. Yesterday, the news that the vice president would now take over a special economic stimulus team, right? We'll actually be hearing about that a bit more from the presidency. But, this is a team that used to report to the president, directly to the president, an economic team. But now it's the president has, assigned that to the vice president.
It's exactly what it means to lead from the front. For some time, for weeks, we wanted to see a presidency that took charge of the situation, to embody the response. And so this is part of what the president described in his speech as part of our national response strategy to, as it were, collectivize or to put it into a whole, as opposed to having haphazard responses. This is intended to, all the donations that will be coming, you can see the private sector has been very much galvanized, donations here and there. State governments have
But the thing still it still needs to be coordinated, because now everybody is almost like falling over themselves to help, yes, to want to contribute. Yes. And so, the president said in his broadcast that the presidential task force on this would be the best organ to sort of coordinate all of this. So I imagine there's a sense in which maybe the vice president is really, and his team are going to be, very, very active in that regard.
Yes, that oversight, that executive face to what is going on is important. Again, that will help to cut off the sense of isolation and cynicism that many Nigerians would feel and say, where are they all the time?
Okay. Well, in relation to that particular question, we have our friend Ajuri Ngilali, senior special assistant, I believe, on information within the presidency. Well, hi, Ajuri. Thank you very much for joining us via the phone.
Good morning, Yori. It's always a privilege to be with you.
Thank you very much. Well, the news yesterday, as you just heard my colleague here, Cyril, we were talking about it, was talking about, seeing something, as it were, from the presidency, maybe the yearnings of people, that we wanted some action. Now you have an executive phase. It's it's a big assignment, right?
It is. I imagine you're referencing the establishment of the Economic Sustainability Committee chaired by the Vice President, Professor Yemi Osinbajo.
Yes, that has several ministers
indeed.
in it.
It's a very, very important assignment. The very strategic nature of it lies in the fact that before now, the Vice President, as the chairman of the National Economic Council, was working hand in glove with the 36 state governors across party lines to try and put together a comprehensive strategy in terms of how federal interventions as it relates to the COVID-19 response will be implemented at the state and local government levels in such a way that there's that synergy so that everything is implemented properly. So they had agreed at the last NEC meeting that not only would there be a ban on social gatherings and public gatherings and the like across the states, but that they would establish an ad hoc committee, also chaired by the Vice President, that would have governors from across geopolitical zones working together to ensure that states are effectively keying in to those federal interventions, not just in terms of public health, but in terms of the economic responses that we've heard from the Central Bank of Nigeria and some of the other measures as enunciated by President Muhammadu Buhari in his presidential address just the other day. So based on that, that work that the Vice President has been doing with the state governors, it's now appropriate in the eyes of the president for the vice president to now chair the Economic Sustainability Committee, which is now tasked with not just putting together evolving palliatives and some of the other things that would alleviate the sufferings of our people as occasioned by the current crisis, but also in the post-COVID-19 Nigerian situation. How are we going to now evolve the economy, kind of grow the non-oil sector, and some of the other very critical factors that all of us are looking at in terms of economic management moving forward. I think looking at the experience within NEC and obviously making sure that all tiers of governance are factored into whatever solutions we are providing under the president's view, that we are able to ensure that everything is working properly. So I think it's in order. And
it's a very high-powered committee because I believe 7 ministers are members of that committee. And
yes,
and crucially, they're charged with, as you said, talking about going forward, leading us into 2023. It's after all of this would have been over.
Well, the key for us is just making sure that the economy is put on the right footing. Clearly, President Muhammadu Buhari has a lot of confidence in Vice President Professor Yemi Osinbajo. That is evident with this action. And I think there's no doubt that if you look at the experience that the Vice President has had in terms of chairing the economic management team, which was in place before look at obviously the National Economic Council, I think the president just saw it as fitting that he has the experience and obviously the water that seems fit to give him.
Yeah, but okay, I hear you. I was making the point that it's not as if this is a sort of a stopgap kind of a measure, because it will. Well, I certainly hope we'll be rid of coronavirus by 2023, and in here we are, where we are here in 2020. It looks like it's a holistic kind of a job.
Well, as you alluded to earlier, you look at the membership. Obviously, you have as the secretary of the committee, you have the office of the secretary to the government of the federation, who is the coordinator of the activities of the Federal Executive Council. So you know that all of the whatever is going on in terms of the activities of the Economic Sustainability Committee, there are going to be repercussions in terms of how whatever measures are activated within that committee, how they're going to be implemented across MDAs with the secretariat, within the secretariat of that committee. And again, on top of that, with the membership, you have the ministers of labor and productivity, labor and employment, the minister of finance, budget and national planning. Of course, you have the CBN governor, the NNPC, GMD, and other very, very critical actors. So as Minister of State for Petroleum Resources, so you put it all together and you will know that these are the key cogs in the wheel in terms of the economic management of in the country.
And as you know, Ajuri, most ordinary Nigerians are concerned with, well, where is the stimulus package for us? I'm sure it must be somewhere in there amidst all the grammar that doesn't necessarily translate to the people that that I'm talking about. And they make up to 50% perhaps as a conservative estimate of our population. Now, the Professor Yemi Osinbajo committee no doubt will be grappling with modalities and interpretation of that.
Well, the very interesting thing here, and I think that this is probably something that cannot be overlooked, is the fact that the social investment programs, which was an unprecedented intervention during the life of President Muhammadu Buhari's administration, was entrusted to the vice president for the first 4 years of the administration. And obviously, the president has had confidence from that if we are going to touch the lives of millions of our people, that we have already done it. Now it's just a matter of how can we expand it, how can we make it a bit more precise to the circumstances that have now come upon the country with the outbreak of COVID-19 and the resulting economic consequences. So for us now, it's just about saying, look, we already have the template, so now let's expand Let's bring more people into the coverage of some of these programs, and then let's also see how we can supplement some of those measures with legislative interventions that can come in play when you talk about how we can offer financial incentives to companies who are not retrenching workers, and some of the other things that can be done. So clearly this committee has a lot of work to do, but I think it's very important that even as we acknowledge the important work that this committee has to do, that we also remember that before the establishment of this committee, President Muhammadu Buhari had already done so much work within under the aegis of the Presidential Task Force on COVID-19 to ensure that we have interventions from the central bank, including a 1.1 trillion naira fund that includes 50 billion naira in soft loans for households across the country, small and micro enterprises, a 100 billion naira injection in the public health care service delivery system of the country in terms of expanding the facilities to Nigerian plants down on the importation of drugs, and also to establish research and development and innovation laboratories across public health institutions in the country. All of these efforts have been put in place by the president, including the palliatives that he mentioned in his address, which included the moratorium on farmer money, market money, and trader money repayment.
One last thing, just before you go, Julian, thank you very much. The president signed into law yesterday the instrument that would give force to really getting us to help ourselves. This whole matter of, locking down, people, staying at home, people not moving around and all of that. Now there is a force of law behind it.
Oh, absolutely. And that's very, very important to mention because, you have a lot of pseudo-legal analysts on television questioning the legality of what the president has put in place. And obviously it was very important, as is the kind of tradition and precedent of the president, to come out and say, look, everything we're doing has to go through due process. It must have legal backing. And he was very clear in citing all of those statutes that empower him to do exactly what he has done. So really, there's no concern in terms of whatever interventions anybody would want to make to question the legality of the president's action. We're very, very firm about the fact that there is a very firm legal foundation on which the president has acted.
Thank you very much. Ajuri Ngilale. Mr. Ngilale is a senior special assistant in the presidency. Thank you as always for coming on.
God bless you, my brother. Thank you very much.
So, as we were saying, we're talking about aspects of this COVID-19, and we ended up on the note there. Everything else is tremendously important, but we ended up on the note of about the best thing we can do to help ourselves, we are told by all the experts, is to just obey the directives and stay put. Because the more we do that, the less chance there is of any kind of, transmission, community transmission, as they say. And as you know, our people were beginning to, people are still trying to reason it out. But this is not a matter of reasoning. It's science. It's proven. Stay put so that they can contain stuff, contain whoever maybe they can. All these people they're trying to. What is that word now? Trace. So that I can trace them, identify them, isolate them, and treat them, as opposed to people walking around. It's going to be for a while, but it's a very, very serious affair. And I think the president signing into law that instrument really, gives the bite to it that this is not play anymore.
Even if we want to separate the goats from the sheep, we can do that later. But coronavirus is war.
It is.
And the first thing you need to win a war is leadership that gives the command, that gives inspiration, that gives the go. The good thing in what the president has done is that, he has taken the bulls by the horn, which was what he did on Sunday, to come out, to give the address, and to offer us, shall I say, so to speak, a formalized window, an opportunity to say, this is how we're going to win the war. Let's all get on board. I think that, and I mean, it was very clear what we should do as citizens and what they will do as government.
And you use the word war in there, and it's so appropriate because the thing seems to be going in ebbs and flows. And now, for instance, another governor, unfortunately, we hear that the governor of Oyo State, Governor
Our prayers are with him.
Our prayers are with him. You know, and then in Lagos, they were discharging quite a few patients. I believe up to 5. Did I see a tweet like that?
5 or 6 or so.
Yeah, they were discharging some. But look, these are good things. But we're under no illusion from what the experts are telling us that we have not peaked yet.
No, we should not be.
We have not peaked yet.
You know, the lockdown came into force last night. But it will take more than locking. You know, there is need to strengthen monitoring. Because today now, some streets are deserted, but in the interiors, you see people playing football, setting up goalposts and playing football. You need to clamp down on this. If you don't do it, you see, we've only passed the first phase of coronavirus. Most of the countries where we're having exponential rise in cases is because they've peaked actually, or they're about to peak. We've only passed the first phase, which I think is the 14th phase, and so.
There you see, I just saw a picture flash by there. People have seen these pictures. The cities fumigating cities and that kind of thing.
In fact, by now we should see virtually every state governor rolling out plans to disinfect their cities.
Indeed.
As of now, we know of Lagos, we know of, I think, Kanu, we know of a few other states, but we're not seeing the sort of broad sweep approach that every governor and every leader of a state must take it and say, look, the minimum we could do is to disinfect, is to carry out rigorous enlightenment campaigns, is to shut down and to enforce.
Exactly. Contrary to, for instance, we have a report that we sent out earlier, but we'll also play it again now. Different Nigerians showing the level that we're applying to this, with divergent views on the lockdown in states. Our man Theophilus Elama, you know, he has this package.
COVID-19 pandemic has caused a stir around several economies. Major economies are shutting down as a result. With Lagos having the most number of COVID-19 cases in Nigeria, the state government instituted a partial lockdown. Now President Muhammadu Buhari has instituted a total lockdown for 2 weeks, starting March 30th.
Actually, they say prevention is better than cure. What Mr. President did, he did a right thing. But what I expect from Mr. President is, first thing first, palliative measures should be put in place, because Lagosians has more than 20-something million people in Lagos. And most of these people, like 75% of these people, are what we call, they are in informal sector.
We have fed the business somehow, but it's for our own good. For our own good. So disease is so spraying everywhere. Go to Italy, see what happened in Italy today. Don't what happened in Nigeria. So we have 2 weeks closed down, no problem.
And this lockdown is what I'm expecting from the government to do before, not now.
Okay.
You understand? I know it will affect us in one way or the other, but at the same time, government is trying to protect us, more especially for this COVID-19.
While there is concern for those who earn daily pay, this butcher believes that the directive is necessary. He says despite the fact that his business will be affected, it's better to be safe.
I dey give you before we then buy market. I pour in on their hand before I collect money for their hand. I myself, I'm using it. If I collect money for customer hand, I use it to rub my hand. And any customer want to buy a market, I'll put for my hand first before I collect money.
Some lawmakers are using this opportunity to sensitize their constituents on the need to stay safe.
But now that the federal government has locked down Lagos, Abuja, and Ogun State, well, I think it's the right way to go. There's nothing we can do about that. But more importantly, there are people that live on a daily basis, hand to mouth, as is popularly called. We need to now start finding ways of mitigating against this situation for them.
Nigeria reported its first case of the novel coronavirus on February 27th when an Italian businessman tested positive. Since then, over 100 cases have been reported and several recoveries. Theophilus Elama, TVC News, Lagos. The COVID-19.
Okay, there was a bit more, but okay, we'll pick it up from here.
Yeah.
You know, again, there's this concern about catering for, you know, those that really need to be catered for.
The day pay earners.
Those
DPNs,
ones.
as we call them.
Yes, call them that.
Yes,
The unbanked, the people that are not even in any statistical database, because at the end of the day, these are lives and they will need to be touched. And it's going to run into trillions.
And if we have 80% of our people living on less than $2 a day, it calls into question, how effectively we will be able to reach them. So this is an extra task facing the committees addressing this issue. Now, the first thing we need to do is that they are reachable. They can be reached because they belong to local government areas, they belong to wards, they belong to units, they belong to households. So one way or the other, there are several tiers of leadership through which we can reach them.
No, our organizational ability is going to be brought into focus.
But of course, we don't have a choice at this time.
It's going to be,
and we must move as fast as we can. We must move as fast as we can.
Because at the end of the day, this is we don't have time for too much analysis, because the big scare is if this thing begins to spread fast, then that, God forbid, would really overwhelm the system. I hear that the best case scenario is that if there must be a sort of a spread, let it be slow, so let it be at pace as they are discharging some, other ones are coming on. But if you have too many people sick at the same time, that's the one thing that we don't want. And that's where it goes back to isolation, this social distancing, and just doing the right thing and stop arguing and stop insisting on fundamental human rights. It is a scientific fact. We can slow it down by isolating ourselves responsibly.
I think the thing we could really do, now you talk about science, which means we need empirical data. So I think the most important thing we should have done is to see how we can test as many as we can.
Okay, yeah.
Because those people that flew from the UK and from other parts of the world that came to Nigeria, they were told to go and self-isolate, which is really not possible in our climate. So but it would have been best if we could test as many as we can. I think the WHO DG, or is it Surgeon, said it that perhaps we don't have the true picture of what is going on because our capacity for testing is not is not where it should be. You remember that as at when the outbreak even began, we had just 2 test centers in the Africa region in West Africa. We didn't even have reagents before those things were shipped to Nigeria.
Talking about those scientific things, we have a doctor in Kaduna who is joining us. Good morning, Dr. A.A.
Yes, sir.
Thank you.
I want to, Uncle Yoru Wandono.
Good morning, sir. Thank you for calling in.
Good morning, sir. I want to talk on this lockdown country shot for this coronavirus something.
Sure.
You see, Nigeria, we have a problem, and our problem is the elite. In developed countries, they lock their country just because of the pandemic, and they know the consequences of that, and they have no cure for that. So the whole country people are not complaining. But now, we here in Africa, in Nigeria in particular, those who think they go to school and they are lawyers, I don't know whether I call them quack lawyers or whatever, maybe notice me lawyer. They just want to be noticed. They are saying Buhari has no right to do this, locking this, that they need to be given notice. Look, China, when Indians, when their president locked them down, he said it is better for him to lock them down to suffer for 21 days than to suffer for 20 years looking for the remedy of the problem these 21 days will cause. A moving about in a day can spread this disease that will cost Nigeria more than 20 years. We did not remedy the problem because we don't have the facilities. Mm-hmm. So the only thing we can do is preventive measures, and which is the president took and is in the right step. So it's better for us to unite now, forget about the politics or religion. Let us join hands together and fight this thing. Mm-hmm. If we are free out of this, then we can say anything. Sure. That time it is a joyful something, but not just to be accused based on political or religious basis. Mm-hmm. Mm-hmm. To me, I think all those people saying Buhari did not do this, we will take them to court. In fact, I term them to be saboteurs.
Thank you very much, Doctor. But as you know, Dr. A.A., the president actually signed the law yesterday. So there is the force of law behind all of that. Thank you very much for calling in. It goes back to the point that we were making that, look, there's a sense in which the president and the presidency, shall we say, even our whole legal system, knowing the right thing to do, has met the situation halfway. Yes, there will be those who begin to talk about it's a federal republic, that you have the states are federating units. You know, when we go into all those kind of theories, you know, then students of law will point these things out. But we don't have time for that, is the point that is being, we don't have time for that. And so there is now a law upon which we can act. And if the law says, stay at home, please, then you can stay at home. Because if you don't, now it can be enforced.
In a Ebonyi
because
state,
as that doctor is saying, as Dr. A is saying, look, apart from the soap and water, that they say, wash your hands, soap and water for 20 seconds, at least, then what he is saying, what that doctor is saying, just isolate, you know, limit movement. So it's contained, as opposed to people walking all over the place. We don't know who is carrying it. We don't know who's going to catch it. That I think is what our people, we all have to come and fully appreciate.
You know, even if you're a very private person and you heard about the virus being in your vicinity, and they say wash your hands to stay alive, and they say wash your hands to stay alive, Uncle Yori, the first thing you seek to do, even if you can borrow detergent or borrow soap, you will borrow and use, and then you can come back later to begin to explain all of those. In Ebonyi State, for instance, the state governor built an isolation center and handed it over to the federal government for use. In Delta State, where the governor has been building, you know, they had one isolation center. Later on, they modified it. Later on, I think he built some 2 or 3 more. In the state where they've now had even one suspected case, the governor is working around the clock to just make sure that, you know, this thing doesn't catch them unawares. But this thing is being built in the Federal Medical Center. So by jurisdiction or by law, these are federal territories. So even when this intervention, they cannot make those interventions in exclusion or in isolation to what the federal government is doing. What I think the challenge that we often have is where there is no trust or where there is no mutual understanding, perhaps across party lines. But the fact is that as at now, we cannot but come together to fight the common enemy.
Indeed. And at this moment, I'm being told that we have online, on Skype, in fact, Honorable Remi Hassan. Remi Hassan is a former Deputy Speaker of the Ogun State House of Assembly, Special Advisor now on communications to the Ogun State Governor. Good morning, Honorable Remi Hassan, if you can hear us. There you go. Pastor Remi Hassan. Can you hear us? Hello. Well, I'm trying. I'm speaking. I'm actually speaking. Pastor Remi Hassan. The very same man that I called Honorable Remi Hassan is also Pastor Remi Hassan. He is the special advisor on communications to the Ogun State Governor. And he, as you can see, he's ready for us. But I think there's a link, the audio part of it, on Skype. So we'll sort that out. One of the things that we'd just like to hear from, you know, the pastor about, Pastor Remi Hassan, is the governor in Ogun State explained that in postponing till 11 p.m. on this Friday, that he had actually gotten the permission of the president. He had spoken with the president, and the president had seen fit to grant permission that, okay, you guys can carry on in that way. Remi Hassan will no doubt explain it a bit more to us, but it was all about to get the logistics together to be able to effectively, you know, shut down, and at the same time get the palliatives or get the systems together. As I said, I don't want to, you know, steal his thunder. He's the special advisor. He's the communication guy. He will let us know. But at least what's out there in the press is that a case was made to the president, Muhammadu Buhari, who then granted permission for it to go like that. We already have Honorable I keep on switching between honorable. The man, as I said, was former deputy the speaker in the Ogun State House of Assembly. But nowadays, I suppose that being under his belt, he's now gone to the highest office possible. He's now Pastor Remy Hassan. You know now. So as soon as we can link up with him, we'll take him and sort of get to understand what the situation of fighting COVID is like in Ogun State, and also the need coming, as it were, more or less from the horse's mouth, being the people in the administration in Ogun State, as to what we are hearing in the paper, what we're reading in the papers, that they have the permission of the president to extend it. But even at that, there are aspects of this, of the lockdown, that actually did commence yesterday, and I think that had to do with vehicular movements, which is another point that is being made. Well, actually, we can talk about the president's statement on Monday was quite clear.
On Sunday night.
On Sunday night was quite clear. But I've since seen that people who have issues, I'm thinking now of the International Press Institute director, who has said that it might have been a bit ambiguous the way the president had just said communication pros. Communication pros, it's possible for the whole thing to be misunderstood because the president has said something like, so long as they could prove that they were unable to work from home. So there was a fear from, some groups that, well, if you leave this kind of a thing to the interpretation of the enforcers, the journalists might get the wrong end of the stick. But we'll come back and continue on that. Mr. Joshua in Irewolede, good morning, and I hope you are keeping well and safe.
Yes, very well, Uncle Yori. Good morning.
Good morning, sir.
And good morning to your colleague.
Yes, thank you very much. Cyril.
Good morning.
I'll just make a comment on the issue of some lawyers challenging the presidential order for people to stay at home. For me, I think leadership is not about being a president. It's not about the title. Each of us should take ownership of leadership as at where we are in Nigeria now. I think the lockdown was actually coming a bit too late, but it's good that it's coming on now. And if we can prevent this matter, it is better than trying to manage it. I think a lot of people are still in denial and thinking that it's this political whatever. We should snap out of that denial and face reality that we are fighting a pandemic that can ravage the lives of people. So
Indeed.
Please, with you there and every well-meaning Nigerian, I think we should prevail on our lawyers. Please, this is not a time to be grandstanding and, challenging power and all that. Let's leave all that till all this thing is over. We understand them.
Indeed.
So please, let's just appeal to them. Let the leadership go around each of us and let us take ownership of this process and manage ourselves out of it. Thank you, sir.
Indeed. Thank you very much for your comments and also for calling in. It's an important one. Yes. It's an important one.
There is this challenge.
Let people be encouraged to start getting falsely combative.
The one challenge with public interest law is that somebody could well win in the court of law but lose in the court of public opinion. There are two different things. And so sometimes some very good public interest lawyers would want to win both in the court of law and in the court of public opinion. Yeah, so, but I mean...
You see, but I hear you. This whole, it's more or less like an intellectual debate, because if people realize that we're in the middle of a war, a health war, it's actually a war, maybe it's because people think that it's just an event that will pass. And we hope that it will be so, but that's false. That's Dutch courage.
The other, yes, and I think the other thing we must avoid is the example of Mexico and some other countries where, while a lockdown is well afoot, people are robbing shops, looting, because of course they may be hungry or there's now an air for them to go out and commit crime.
So those are the kind of things we're trying to prevent.
The IGP said some days ago that, look, they have received intelligence that people, fraudulent people, cyber criminals and so on, we're going to be on the prowl to use this as an opportunity to, particularly at the time when people are also crying that, look, data for their phones, when they are home and they are not working, the price of the tariff for some of these things should even be crashed.
Yes.
So there is a curiosity. There is this chink that bad people can capitalize upon to defraud others. It is important that, you know, when we make these declarations and when we are working for the social good, it is not just one end working to the other. It should be both ends working to meet midway. So from the government side and on the side of the people, there are responsibilities.
Indeed.
There are things to be done.
Indeed.
What we should ask ourselves is, how am I leading my space? First, lead myself, and then lead those that are within my sphere. Even if it's just my family.
You're so very right, I know, as you say that. But I think you've also alluded to the fact that this is not a joke. Let me not be guilty of overstating it. We have a war on our hands, and it depends on us how dispersed we want to make the war, or do we want to contain it. People that are busy going through legalisms of who has the right to is it the governor, is it the president? I don't know why these things are going on. That's
because we're in a republic.
That's just my own personal opinion.
You cannot take away the right of people.
But we can't live in isolation. You look around the world and you look what everybody, every sane person in the world is saying. And so you come and start in your own little corner of legalism here when everybody from African presidents to Boris Yeltsin not Boris Yeltsin, the other Boris.
Johnson.
Boris Johnson will come out. He's working from within isolation, and it's now become a mantra that what you have to do is just stay at home, isolate, don't go out. But every country, as we say locally, getting on. There are people even in those areas that will be saying things like, no, they don't have any right to do this. So it's not peculiar to us, but one just hopes that the overwhelming majority of people will see reason and catch on to the whole symbolism of
what needs to be done.
What needs to be done. I believe that Pastor Remy Johnson, we can get him now.
Hassan, you meant to say?
I meant to say Remy.
He could be a pastor or honorable.
I meant to say Pastor Remy Hassan, who is also been known in the past as Honorable Remy Hassan. Is one and the same person. And we're glad to have you now, sir. Special advisor on communications to the Ogun State government. Thank you very much for coming on.
Thank you very much, Mr. Yori. Quite an age.
Indeed. It's been quite a while. We're delighted to have you. First of all, we've been trying, before you could come on to, just grab at what we could from the papers. But now that we have you, maybe you could explain a bit, Ogun State, needing a few more days and haven't got the permission of the president to indeed take those few more days to then join the rest of the states that have been specified in the total lockdown.
All right, thank you very much. Good morning, Nigerians. Good morning all over the world where you probably are watching or listening. We are a peculiar state, peculiar in our geographical configuration in Nigeria. It's so peculiar that we, apart from the Nigerian territorial waters in the Atlantic, Lagos is landlocked by Ogun State. And that means you can't possibly come out of Lagos without passing through Ogun. That's one side of it. The other side of it is, even under the tax residency rule, close to 1 million people living in Ogun State, residing in Ogun State, who work in Lagos. And that exposes us to the likelihood of being vulnerable in this pandemic. And Lagos, of course, is the epicenter in Nigeria. And that means whatever goes on in Lagos, we use it as a measure of our preparedness such that we're not caught napping in any way. We were looking forward to a lockdown, total lockdown, but it came earlier than we were anticipating. And when it came, the governor had no choice than to make representation to the presidency as to the need for those who need to do some bit of stocking up for this fortnight that the lockdown is to last.
Mm-hmm.
Quite a number of our populace are people who eke out a living from daily endeavors.
Yes.
The state also is looking at how to bring up palliative to help the poor of the poor, not necessarily everybody, those who truly, truly need it. Transporters who earn their living by their daily routine. If someone is making, for example, 10,000 naira a day, if the state can say take 1,500 or 2, maybe it's for 2 or 3 days, just so that you will support yourself.
Mm-hmm.
All of this we need to work out within these days of extension that we requested, and the presidency graciously granted it. However, the borders, both the international borders and the state boundaries that we share with Lagos, with Osun, with Oyo and Ondo, Ekiti is the only state in the whole southwest that we don't have a boundary with. All those borders are already closed from 11 p.m. last night.
That's
and
right.
Except for those who fall under the exemptions that were granted, nobody can cross any of those borders now because the security agencies are taking full charge of those borders. But intrastate movement that will help people to prepare for the lockdown is still permitted between now and 11 p.m. on Friday.
Okay.
That essentially is the true picture.
Mm-hmm. And what are the figures in Ogun State? Do we have any figures of people who have come down with it?
Yes, as at yesterday, the total number of cases that Ogun State has recorded that are confirmed are 3. The very first in Nigeria, of course, you remember, is from Ogun State. 2 of them, however, are discharged from the infectious disease hospital in Lagos because they are well and they have now tested negative.
Okay.
So it's actually 1 that is still under treatment at this time. And we are trusting that with the kind of response we have gotten, that too will most likely be out soon. However, one of those exposed to the last case, there are some revelations that are coming out. But I'm sure by now the Commissioner for Health should have the true position. And by 12 noon today, we'll be addressing a press conference on that.
Okay.
If it is positive, we'll let the people know. If it is negative, people will know, as it were. But then, as of today, we have 3 and 2 already discharged. 1 is undergoing treatment.
Okay. Your governor, Prince Dapo Abiodun, we read, has been inspecting a 1-bed facility, isolation facility at HID Awolowo, center in school, I believe, in Ikene. Will you tell us a bit about that?
Yes. For us as a state, like I said, our contiguity and proximity to Lagos is making us prepare for the worst. But even then, we still expect in the circumstance and hope for the best. We do not have cases needing to be isolated now.
Mm-hmm.
However, we're preparing for the likelihood of a surge. That is why we have about 3 centers as of today.
Okay.
The one that was unveiled yesterday is at a model school facility in Ikene, the HID Awolowo Memorial Model College.
Mm-hmm.
The dormitories of those, the school, have been converted to an isolation center, equipped with state-of-the-art facility, with good ambience that will make even anybody who goes down with the virus, the environment alone will get you well fast because of the way it has been equipped and put in such a good state and very clean environment. That is 1, 128 bed space. We also have another one at the Iberekodo General Hospital in Abeokuta. That hospital is an existing infrastructure. However, we have decided to remodel it to be an isolation center. It can take 100. 50 beds are already installed. The remaining 50 will come in at the close of work today. So the 100 will be ready latest by tomorrow. We also have a purpose-built isolation center, originally conceived as an isolation center for Lassa fever.
Okay.
But of course, with the coming in of COVID-19, we quickly had to refocus as to what it is to be used for. It's a 42-bed space at the Olabisi Onabanjo University Teaching Hospital in Shagamu. Those are the three that we have prepared for. In all, they afford us about more than 300 spaces. However, there are spaces that have been gifted to us by well-meaning Nigerians, especially people who are part of the Ogun State project. Our father, the father of Nigeria, Chief Olusegun Obasanjo, gave us his residence at the presidential hilltop to be used. That can take 32 spaces, bed spaces rather. However, we intend to use it as an isolation center for symptomatic people that are yet to be tested. The moment they are tested and they are confirmed positive, we move them to the state-established isolation center that also double as treatment centers. So the isolation center that we will convert Baba Obasanjo's house to, and the one gifted us by Mr. Fola Adeola, will only be used as isolation centers for those yet to be tested but are symptomatic. Once they are tested and they are confirmed, we move them to those isolation centers that also double as testing locations.
But to be clear, all of these facilities are, just preparing for the worst, but you actually have no more than maybe just a single case in Ogun State.
It's a single case that is within our facility at this time. But like I said, it is better to have it and not need it than to need it and not have it.
And exactly. And I don't know how it's going to work out. Should there be, God forbid, should there be a need if other centers overspill, in the spirit of cooperation, no doubt, arrangements can be worked out. Because at the end of
one of the things we are doing is that we have put all our local government headquarters on notice to identify public buildings, event centers, and locations that can be converted to isolation centers within their jurisdiction. And the government will put them aside, and whenever there is any such, we will be able to deploy immediately and convert those centers to isolation centers. We also need to mention, too, that as a state, if you check the healthcare architecture in Nigeria, the testing centers, the biomed lab, are exclusively owned by the federal government, and they decide where they site them. The one in Lagos, there's another in Irua, there's one in Abuja, one has just been put in the University College Hospital, Ibadan, just a few days ago, and there's one in one of the states in the north. All of them are owned by the federal government, and federal government decide where they site them. They have concluded that we are too close to Lagos, we don't need another. But our contiguity with Lagos exposes us. And so one of the steps we have taken is that as a state, we have broken every protocol to order our own biomedical lab, which will arrive in Nigeria and will be installed by this weekend. So we'll be the only state in Nigeria that can conduct a test from its own facility. Wow. That is one of the steps we have taken ahead of other states. And one of the things we're looking at is if there is a surge, even in Lagos, we'll be able to take those spillovers just to be in a position to contain this pandemic in Nigeria.
I want to thank you very much, Pastor Remi Hassan, Special Advisor on Communications to the Ogun State Governor, for coming on. And no doubt we'll hear a lot more at the press conference that you said we'll be holding later on in the day. Thank you very much for coming on TVC.
My pleasure.
This morning. Okay, so we'll take a break now.
Every part of the state is going to